Hello, I'd like to welcome you to A Healthier You. I'm Larry Macon Jr., and I'm pastor in Mount Zion, Oakwood Village. Also, I host the show on It's About You on a segment called Everyday Champions, where I talk about people that are doing great things in our community. But during this pandemic, this series is about you. You know, as a leader in the community, I felt compelled to make sure that we get the latest information in all areas of health. And so I'm pleased to be partnering with the university hospitals to spread the word in our community about how you can live a healthier life. So today I'll be speaking with Alex Lai, who's a nurse practitioner from university hospitals. Thank you for being on the segment, Alex.
Thank you, sir. Thank you for having me.
No problem. So tell us, what are we going to talk about today, Alex?
We're going to be talking about colorectal cancer.
Okay.
So colorectal cancer is a type of cancer that occurs in the colon or rectum. The colon is the large intestine or the large bowel. The rectum is a passageway that connects the anus to the colon.
Okay.
Sometimes abnormal growths called polyps form in the colon or in the rectum. And over time, some of those polyps may turn into cancer. To share some statistics with you, sir, colorectal cancer is the third leading cause of cancer-related deaths in the United States. It is also the third most common cancer in men and women. It typically happens more common among men than women. It is also worth noting that incidences and death rates among younger people ages 20 to 49 are becoming more common.
Wow, that's amazing. And I know there's also a concern in the African American community. So what do you have to say to that particular community about this colon cancer phenomenon?
That's a good question. So what should African Americans know about colorectal cancer? Many studies have shown that the incidence of colorectal cancer and deaths from colorectal cancer are statistically higher among African Americans than any other racial and ethnic groups.
Wow.
There is also some evidence that show African Americans are less likely than Caucasian to get screening for colorectal cancer.
Okay.
Also, African Americans are less likely than Caucasians or other ethnic groups to have colorectal cancer polyps that are detected at a time when it's easily removed. They seem to get it a little bit later than the other ethnic groups.
Wow.
And furthermore, like to add that African American population are more likely to be diagnosed with colorectal cancer in more advanced stages when there are fewer treatment options available. And some of the factors that attribute to this statistical disparity is that there are many, and some of the leading theories are genetic factors. For example, polyps seem to form deeper in the colon, lifestyle, and in my personal theory, access to healthcare.
Okay.
And it's been in the news recently that an actor, Chadwick Boseman, who starred in Black Panther last couple of years, he recently passed away from colon cancer at the age of 43. And Mr. Boseman was young and African American. So, and because of this statistical difference, the African American population are more vulnerable when it comes to colorectal cancer. That's why the screening for the African American population should be done earlier, and most experts recommend age 45.
Wow, age 45, and I guess I also heard in Chadwick's scenario, he was only about 38 when he was diagnosed, so he found out even a lot earlier, which I heard are due to some genetic, challenges he may have had.
Possibly.
So how do you reduce these risk factors?
So some of the risk factors for colorectal cancer, they typically increases as you get older. Statistically, 90% of cases occur in ages 50 or older. Some other risk factors include if you have history of IBD, such as Crohn's disease or ulcerative colitis, personal or family history of colorectal cancer or polyps. Lifestyle can also play a role. The people who are more sedentary tend to have a higher risk factor. People who eat diet that's low in fruits and and vegetables.
Okay.
They eat diet that's high in fat content and highly in processed meats,
Mm.
overweight, obesity,
Mhm.
and tobacco and alcohol.
Wow. So you can basically prevent this from happening, or at least lower the risk by just living a healthier life.
Exactly.
Wow.
And well, what can you do to reduce your risk factors?
Yeah.
Um, Exercise, lose
Mm.
weight, stay active, eat a diet that's rich in fruits and vegetables.
Mm.
Try to reduce your intake of processed meats like bacon, sausage. Those are two that comes off the top of my head.
Mhm.
And stop alcohol and smoking.
Wow.
That and basically live a more healthier, active lifestyle. Those things will lower your risk factor for colorectal cancer.
Gotcha. So we're lowering that risk factor. So what are some of the symptoms that people should look out for?
The symptoms is one of the, there are many, but some of
Mhm.
the key symptoms are
Mhm.
blood in the stool. That
Okay.
should never be ignored. It could
Okay.
be as benign like hemorrhoids or anal fissures, but you
Mhm.
want to let a doctor evaluate you to see that is not just it could be possibly more dangerous than that.
Mhm.
Also, want to look at changes in your stool appearance. Like,
Mhm.
for example, if you notice that your stool caliper turns really thin, like pencil thin caliper,
Mhm.
that's a warning sign.
Mhm.
Or changes in your bowel pattern.
Mm.
Um, and if your doctor tells you that you're anemic and you have no other explanations for the anemia,
Mm.
or unexplained weight loss or abdominal pain.
Mm. Wow. So if you see those things, if you're watching, you may need to get checked out. And so what are some of those screening tests before we go that people can get done so that they can see if they have a challenge, or hopefully get clearance that they don't?
Sure. And before we go into screening tests, I just want to explain what screening test means.
Okay.
Screening tests are tests that you get tested for prior to any symptoms.
Okay. Gotcha. Gotcha.
Okay.
Mhm.
Prior to any symptoms, like the symptoms I mentioned earlier,
Mhm.
that you don't have those symptoms. You're just going for a screening test.
Mhm.
Now, if you have those symptoms that I mentioned earlier, then it's no longer a screening, it's a diagnostic.
Mhm.
So when I mentioned that the age of colonoscopy is like 45, 50, that's for screening age. Obviously, if you have like some of those worrisome symptoms I mentioned, like blood in your stool, changes in stool caliper, you
Mhm.
got to get those sooner, like even if you're in your 20s or 30s. So I just want to just emphasize what the screening test is for. It's for tests that you don't have symptoms yet.
Gotcha.
So
Gotcha.
the the uh, the screening tests for colorectal cancer, there are basically two types. One is stool based, and the other one is a more invasive colonoscopy.
Okay.
There are basically three types of stool tests. The first common one is called guaiac stool
Okay.
test, where the test simply looks for presence of microscopic blood in your stool,
Mhm.
and you would get that once a year.
Okay.
The second test is called a FIT test, and that stands for fecal immunochemical test, that
Okay.
uses antibodies detection to look at the stool in your sample.
Mhm.
That's a little bit more sensitive, and
Mhm.
that's something that you would get also once a year.
Mhm.
The
Gotcha.
third common stool test is a combination of the FIT test that looks at the antibodies, and this, in addition, this test looks at the DNA. So it looks at your stool for blood, antibodies, and DNA in your stool sample to determine if there's anything to be worried about. And that, a common, you see that on TV a lot, that test is called the Cologuard. And
Okay.
that test, you have to get either 1 to 3 years. So the
Mm.
stool tests are tests that, again, you screen for when you have no symptoms. And these stool tests they have some degree of false positive and false negative. That's why you have to get them once a year. So it's not like you get one of these tests and then you like forget about it for years to come. It's something you have to do every year.
Wow.
The other test, the gold standard is the colonoscopy.
Gotcha.
The colonoscopy is it's a test that requires degree of preparation. You have to first clean out your colon with this bowel prep to clean out your colon. And then the gastroenterologist will sedate you to some degree for the procedure. And they insert a thin, flexible, lighted tube inside your rectum and looks through your large colon to detect any check for polyps or any anomalies that they may find. Okay. And that test, unlike the stool test, is not only diagnostic, it's also therapeutic. For example, the stool test always checks for our presence of blood, antibodies, or DNA, and that's all it tells you. It's kind of vague. If you're positive, you have to get a colonoscopy. Gotcha. So colonoscopy, you look at it visually, your entire rectum, all the way to the end of your large colon, and it looks for presence of polyps. And if it does find a polyp, the gastroenterologist using the colonoscope can reach out and reset that polyp.
Wow.
Then that polyp gets that polyp gets sent to the pathologist, and then they make a determination of what this polyp is.
Now, I like what you said. That's the gold standard. So
yes.
For those that are watching today, we want to encourage you to get a colonoscopy at the right time, and that, as your doctor suggests, and also your nurse practitioner. So Alex, when in life do you think that people should get this type of test?
The U.S. Services Preventive Task Force, that's the government agency that that the government looks to for these suggestions, suggests that your first screening colonoscopy begin at age 50 and all the way up to age 75. Gotcha. Now, as I mentioned earlier, for some special populations like African Americans, the screening colonoscopy should be done starting at age 45. Wow. And there are many, there are some associations, like for example, the American Cancer Society also recommends 45, and University Hospitals has adopted that suggestion to start screening for everyone. For everyone at age 45. And again, I want to emphasize screening tests are to look for anomalies in the absence of symptoms. So what I want to emphasize is that, like, don't wait till you're 45 to go get tested. If you have some of those symptoms I mentioned earlier, blood in a stool, abnormal stool caliber, anemia, unexpected weight loss at a much younger age, go get it checked out now.
Get it checked out if you see it. And so how often should you get that test?
It depends on what is found. For example, let's say you have no symptoms and you go get a colonoscopy and they didn't find any polyps. Your next colonoscopy could be 10 years.
Gotcha.
Colon cancer is a slow growing cancer. So that's why you could wait up to 10 years if your colonoscopy was normal. Your frequency of repeat colonoscopies, they call surveillance. Oops.
It's okay.
Okay. So my phone just rang. So so screening colonoscopies again starts at 45 and extends to 75. And how often you get it will depend on the outcome of your first colonoscopy. If it's clean, you may not have to do it again for 10 years, unless you have some symptoms. Some patients depend, like if they find numerous precancerous polyps, your gastroenterologist may ask you to come back and get a surveillance colonoscopy long before 10 years, like possibly 1, 3, or 5 years. Again, that would depend on what was found in that first colonoscopy.
Gotcha. So that first one is critical, and it shows you
Absolutely.
maybe what the picture looks like going forward. But again, the greatest part I think about our talk today is how you can prevent and lower the risk by living a healthier lifestyle. As Alex said, there's many ways to lower the risk and make sure that you get this screening, especially in certain communities. So thank you so much, Alex, for expanding your knowledge. And if you have something else you want to share.
I just want to make one more point about these screening tests. I mentioned the stool test and I mentioned the colonoscopy. The colonoscopy is, like I said, it's the gold standard, but it's quite involved. You got to take time off work. You got to do this bowel prep. I don't want that to discourage people from getting screening colonoscopy. I mentioned the stool test that are much simpler. You just submit a stool sample, but the best colorectal screening test, sir, is the one that gets done.
Gotcha.
It's the one that gets done.
The one that gets done. That's the best one. So go and get it done at the right time. And I think you'll be definitely in good shape. So thank you so much, Alex, for this talk. Thank you for being on this segment. And also want to let you know to make sure that you tune in on my social media, also to my website, LarryMaconJr.com, and contact me and let me know if you have any further concerns or any questions. I will lead you down the path to university hospitals where you need to schedule a visit. And I know Alex is standing by and he's ready for anybody who's coming in who needs some help. Remember, don't forget, I always say, this is my saying, good health is wealth. And so you want to be wealthy to be healthy. And so thank you again, Alex, for being on this segment, and we'll see you on the next one.
Thank you, sir. Thank you for having me. God bless.
God bless.
Bye-bye.
Bye-bye.